My name is Kelsey. I'm an occupational therapy student, and I'm going to be working with you today.
Hi, Kelsey.
Hi. Can I start by just verifying your name and date of birth?
Sure, my name is Charles Bishop, and I was born on March the 3rd of 1955.
Okay, nice to meet you, Charles. Can I check your bracelet real quick?
Why, sure.
Awesome, thank you. So, Charles, I have read over your chart a little bit, so I kind of know what's going on with you, but in your own words, can you just tell me what brought you into the hospital?
Well, I have congestive heart failure, or so they tell me. And I feel like I've been managing pretty well until recently. So I've had a shortness of breath. I haven't been able to catch my breath, and I just have noticed my legs I'm really swollen. I mean, if you look at them,
Yeah,
those don't even look like my legs.
They don't. So you got pretty bad edema, it looks like, which is it's
same.
very common with congestive heart failure. I can actually give you a handout maybe at the end of our session, and it's got some tips and tricks and activities that you can do to try and get that edema to go down. And they are things that you can just do throughout your day and at home. So I'll go over that with you at the end of our session, okay?
That sounds good.
Yeah. So you told me a little bit about some of your symptoms that you're experiencing, and I know those can be pretty uncomfortable. In regards to your health, how has your health been with these congestive heart failure symptoms, and how have those impacted your just like everyday functioning?
Well, I recently retired, and so did my wife. So I haven't been doing as much as I used to, but we do a lot around the house. We like to go on walks, and I also started coughing, and so I've just had the nastiest cough and shortness of breath, and it's like I cough but I can't breathe, and so it's just been hard to do anything. And we like to do things together, even like chores and stuff, but lately my wife has been doing all the work because I just cannot catch my breath, and I have no energy, and I'm just so tired I just can't even do anything.
Well, I am really sorry to hear that, Charles. It sounds like your wife is pretty great for, helping you out with all of that.
Yeah, she's pretty great, but it just makes me feel bad for her.
I understand that. Well, congrats again on retirement. That's very exciting.
Oh, thanks.
One of the things I would like to do first is an assessment called the Canadian Occupational Performance Measure, or COPM for short. And what it's going to do is it's just going to give me an overview of some of the things that you do in your life that are a priority to you. And we can kind of figure out which things we might want to work on the most and which things you're struggling with the most, kind of like that. And it's a very simple assessment, and I'll walk you through that, okay?
That sounds good.
All right.
The COPM is a tool that opens up conversation between the client and practitioner to identify what occupations are important to them and determine where the deficits are. It addresses ADLs, functional mobility, life participation, and occupational performance. The practitioner should have adequate training via the manual to ensure administration is valid and reliable. This is what the COPM form looks like that I will be filling out for Charles.
Okay, Charles, so we are going to do this COPM, and it's in this little pamphlet right here. I'm going to be filling it out, but you're welcome to read anything that I write down. There's no secrets here. So I'm just going to be asking you questions in regards to your occupational performance. And I'm just kind of trying to figure out where you're having struggles, where you're having difficulties. And to start off, I just want you to kind of list off some things that you maybe enjoy doing, things that are a priority to you, maybe like chores that you do around the house regularly, just things like that. So
All right.
you can just tell me a little bit about what you like to do, and I'll be filling this out.
All right. Well, my wife and I have a pretty good morning routine. She wakes up early every day to go to Pilates, so I get up and I make the bed, and I go take a shower, and I get dressed, and I brush my hair, brush my teeth, fix my hair, and then I go and I make myself some coffee, and pretty much wait for my wife to get home and start breakfast so we can eat breakfast together.
Okay.
And usually during that time, you know, sometimes I'll go for a nice little walk and maybe go tend to our garden a little bit because we like our
Yeah.
garden.
That's so cool. Do you have a green thumb?
A little bit, but it's mostly my wife.
Okay. Yeah, I've got a pretty black thumb, unfortunately. I kill everything I touch, but I still enjoy it.
Like,
So out of those things that you've mentioned to me, let's go ahead and pick 5 of them that are the most important to you that you really want to get back to doing fully.
all right. Let's see. Definitely getting dressed because I like to look nice and you can't be naked.
That is true.
So another thing is taking care of my hair and brushing my teeth because I'm retired, but I used to be a dentist.
Oh,
So
wow.
my teeth are very important.
That
to
is
me.
very impressive.
Yeah. Let's see. My coffee.
Your coffee.
Love my coffee,
Oh, I
and
feel you there.
bless my wife, she's a great cook, but she can't make coffee to save her life. So I have to make my own coffee. That's pretty important.
I bet you're very good at it though.
I am. I've had many years practice. Let's see. How many was that?
We've got 3. You've got 2 more left that we can put down. You mentioned a couple of random things like walks and gardening. You also mentioned you like to help your wife out by like making the bed.
Oh, yeah. Making the bed.
Making the bed.
Yeah, that's a
Okay.
big one. She really likes having our bed looking nice, and I
Aw.
just feel so bad when I can't do that for her because I haven't been able to lately, so she has to do it herself or it just doesn't get done.
Well, that's sweet of you to consider that for her.
Yep, so that would be a good one for sure. And last one I'd have to say taking showers because taking showers.
Taking a shower.
Yeah, because I like to be clean and
Okay. The way that you take a shower currently, like, can you just explain how you currently do it?
oh, I mean, how does everybody take a shower? I get in there and wash myself. Oh, you mean do I stand or do I sit in the chair like
Yes.
an old person?
Yeah, not like an old person, but I am curious if you were using a shower chair or bench or anything.
I stand. I do stand.
Is it a struggle for you because of standing and it takes a lot of energy?
Yeah, you know, my wife uses a shower chair and sometimes I borrow it, but I usually try to stand, but it does make me more tired. Maybe I should just give up and sit down.
That's probably a good idea, especially if you want to keep doing that independently.
Yeah, I do. No one's gonna help me shower.
Okay, so now that we've listed all of your top 5 priorities, we're going to go ahead and rate a performance section and a satisfaction section. So what that means is that there's a scale up here, and it goes from 1, you're not able to do this activity at all, to 10, you're able to do it extremely well.
All right.
So we're gonna start with that section, the performance, and we're gonna go one by one. So in
Okay.
terms of dressing, which was important to you, how well are you able to do that on a scale of 1 to 10?
Oh, I don't know. I mean, I do it, but it just takes a while. So maybe like a 4 or 5.
Okay. And grooming, how do you feel about your toothbrushing and fixing your hair?
That one's not too bad, but I do it right after the shower, so I'm usually pretty tired by then. So maybe like a 6.
Okay. How about making your coffee?
Oh man, you know, walking all over that kitchen, getting all my stuff together, I get real tired, and it takes a long time to make my coffee, maybe like a 3.
Okay. And making the bed?
That one's real hard.
Yeah,
I
can see
almost
that.
say that one is at a 2 because I really don't do it much anymore.
Okay. Well, we can work on that. And then last is the showering.
That one I'd probably also give like a 4 because it takes a while and I get pretty tired.
Okay. So we finished with the performance section. We're going to do the satisfaction section. So basically, how satisfied are you with the way that you're doing that activity now? And then it goes from, again, 1, you're not satisfied at all, to 10, you are extremely satisfied. So going back to dressing, how satisfied are you with the way that you're doing it now?
Let me see. I mean, I have to go and get my stuff out of my drawer and go get stuff out of my closet, and then I gotta go sit on the bed because I'm so tired I gotta take a break. And so I don't know, I mean, I feel like there's better ways, so probably like a 3.
Okay. And then how about grooming?
Like brushing my teeth and stuff. Oh, that one's pretty okay. I'd give that one maybe like a 7.
7, okay. And making your coffee?
Making my coffee is rough. I have to run all over the place. I'd give that one a 2.
A 2. And making the bed?
Oh, goodness gracious, a 1.
1.
That's
And
not good.
we can work on that. And then how about showering?
That one's okay, but not very good. Maybe like a 4.
4? Okay. So I'm going to just take an average of these scores and then get an overall one, and then we'll talk about your results, okay?
Okay.
This is what the final page of the form looks like, and I have finished scoring here and jotted down some notes at the bottom.
Okay, Charles, so after going through these scores, then I came up with some averages. Your average for the performance area is a 3.8, and the average for the satisfaction area is a 3.4, which those aren't terrible, but they're not great either, which is fine because you do have some symptoms that are slowing you down a bit. So your scores aren't that bad, but there is area for improvement. We will go ahead and do this same assessment again next week at our session, and then we can compare your scores now to your scores then and see if you're making any improvement in these areas. And I did write down some notes, just general ones about how, you know, a lot of this is due to your struggle with the shortness of breath and general weakness, and you desire to, you know, be pretty helpful to your wife around the house, and your morning routine is really important to you. So those are things I'll keep in mind when we're helping to set your goals later on. So your doctor did tell me that you are stage 3 of heart failure, which means that you cannot go over a 3 on the Met Levels chart. And I can show you that chart a little bit later, but luckily,
yeah, I've seen it.
You have seen it. I figured you probably were familiar with it. Luckily, most of those problems that you address that you want to get back to doing are within your Met level, so we can continue to work on those. The only one that's a little iffy is the showering, and that's because you said that you shower standing up, and that's kind of outside of your Met level, but if you did go ahead and utilize that shower chair, since you said that your wife uses it anyways, it's going to help you conserve energy in that shower, because I know you said that it exhausts you a little bit. So if you utilize the shower chair, it's going to save some energy so that you have more energy to do these other things later on in the day. Does that make sense?
Yeah.
Okay. So yeah, go ahead and start utilizing that shower chair for me, and that'll be a good start with that. But other than that, we can go ahead and start working on these in our interventions and get you back to doing those things that you love.
All right.
So another way we can measure exertion is by assessing our vitals, and we could do like blood pressure and respiratory rate to just kind of see how our starting point is. And then if we do some activity, we can see how those change to determine if you're, becoming exhausted, if your heart rate's going up, if your breathing is increasing, and things like that. And since we're going to be getting out of bed in a second to do another assessment, I'm going to go ahead and get those vitals right now so that we can get a baseline. Is that okay?
Okay.
Okay. So first, I'm going to go ahead and use this device, and we are going to test your oxygen. So I'm going to have you stick out your finger for me. Yep. I'm going to put that on there. We're going to see what you're at. Okay, it does say that you're at a 93, which is a little low, but we'll just keep monitoring that throughout our session. And if it gets too low, we'll cease any activity. But we can go ahead and finish with therapy today. Now I'm gonna go ahead and take your blood pressure.
Okay.
And I did read in your chart that you have hypertension, is that correct?
My blood pressure's high.
Yeah, okay. You do have high blood pressure. I saw some of your readings from earlier, and if we're consistent with what those readings have been, we'll go ahead and continue with therapy. If it's any higher, we might not, because it does seem like your blood pressure is pretty high. So I'm gonna go ahead and take your arm.
I take my meds though.
You take your meds? Well, that's good. You should definitely keep taking your medications. Those should help. Do you take them regularly, or do you forget sometimes?
I take them pretty much every day. My wife usually reminds me.
That's good. Sounds like your wife is pretty handy to have around.
Yeah, she takes good care of me.
Okay, so if you will uncross your legs for me. And then just relax your arm. Okay, your blood pressure was 141/90, which is a little high, but it seems to be pretty consistent with the rest of your blood pressure readings. So we can go ahead and continue with therapy, and again, we'll just continue to monitor that, okay? I'm just gonna go ahead and get your pulse here. So I'm gonna move your watch a little bit. Thank you, sir. Just hang out and relax. So your pulse was 71, which is perfectly fine for you. And your respiratory rate was pretty high. It was at 23, which is pretty consistent with having, shortness of breath. You do tend to take more shallow breaths, I can tell.
Yeah.
And while it is pretty high, we can go ahead and continue with therapy. Again, we're just gonna keep on monitoring that. Ideally, I would like it to be under 20, but that'll just kind of come with time. It'll come with therapy, it'll come with taking your medications and things like that. So something that I would like for you to work on is pursed lip breathing, which I can give you a handout over, and we will go over within our session, okay?
All right.
The Borg RPE is a widely used tool used to measure an individual's perception of their effort, exertion, breathlessness, and fatigue during physical tasks or activities. There is established validity and reliability for monitoring and prescribing exercise or activity intensity, and there's excellent retest reliability in relation to heart rate and MET levels.
All right, Charles, so now we're going to do one more assessment. It's called the Borg RPE, and I'm going to show you a specific scale, and you're going to kind of rate how much effort or exertion you're putting towards some of these tasks. I'm just going to have you do some everyday tasks, very simple things like getting out of bed, and then I'm going to show you the scale that I have right here. And you're going to help me figure out which rating you would say. So it goes from 6, which is just like, light, you're not hardly putting any effort into it, it's very easy for you.
Okay.
And it goes all the way down to 20, which is like extremely, extremely tough, and you're putting lots of exertion into it. Does that make sense? Okay, if you have any questions, you can ask me. But we're gonna go ahead and start, and since you've been laying in this bed for a while, I just want you to naturally just come up and come to the side of the bed for me how you typically would, okay?
All right.
Okay. Okay. Seem to be a little out of breath there.
A little bit.
So just coming up onto the side of the bed like that, what would you rate that as?
Oh man, that was kind of hard. I would say like a 15 hard.
A 15? Okay. All right, so now we're going to have you stand up on the side of the bed. Before I get you up, we're going to put on this safety measure. It's a gait belt. I'm sure you've probably seen one before.
Oh, yeah.
Do you have any lines or tubes in your stomach right now?
No.
Do you mind if I check?
Go ahead.
All clear. I'm gonna give you a little hug. Have you been hugged today?
Just now.
Has your wife been up to see you at all?
No, not yet.
No.
It's still a little early for her.
Yeah, I get that.
She's taking care of the house right now. But I reckon she'll be up later.
I guess somebody's got to take care of the house, huh?
That's right.
All right, this will be pretty tight while you're sitting down, but when you stand up, it'll loosen up a bit.
Yeah, it's squishing me a little bit.
You are considered a fall risk right now. I know you haven't had any falls in the past, but they just go ahead and put that precaution on you because you do have that weakness and fatigue and shortness of breath.
Yeah,
so it's just a
that makes
precaution. So that's kind of what this gait belt is for. This one's a little big, but we're gonna make it work. And so I just want you to go ahead, take your time, and I'm gonna have you just stand right on up, okay? You seem a little out of breath.
A little bit,
Yeah.
but not as bad.
Okay, well that's good. So for just coming to standing right now, how would you go ahead and rate that one?
Probably about a 12.
A 12?
It's somewhat hard, not too bad.
Okay, that's good. All right. Well, I know you've been in this lovely hospital gown for a couple of days.
Oh yeah.
So how would you feel about changing into your comfy clothes?
I might just kiss you.
Well, we can't do that, but I might give you another hug later if you're lucky.
Okay.
So I'm gonna have you go ahead and come to sit right here.
Okay.
And these are your clothes over here, correct?
Yes.
Okay, I'm gonna bring those over to you. So something that can make getting dressed easier for you when you're at home is gathering all of your clothes up first and then bringing them close to you, and then you can sit down on your bed, and then what you have everything right there to finish getting dressed. You've got your pants, shirt, shoes, and socks, everything you need, so you don't have to be going all over as you're trying to get dressed, because that expels a lot of energy. Does that make sense?
Yeah, that's pretty smart.
Yeah. So now I just want you to go ahead and put those clothes on like you normally would, just so I can see how you're doing with that and how much energy you're putting out. So start with whatever you want. You doing okay?
I'm doing all right.
All right. I know, but it looks like you're doing pretty well. You got some good finger dexterity going on there.
Now the pants.
Now the pants.
Right. Oh, these are my favorite pants.
I'm so glad. Since bending over takes a lot of energy, something that might be an option is you could prop your foot up like this, and then you could always loop it over your foot when it's propped up on your knee like that. And then that way you don't have to be bending over, which could cause more shortness of breath.
Like that.
Yeah, that's great.
I'm pretty tired.
I can see that. So whenever you're doing these tasks that require a lot of effort from you and you end up being really short of breath, you can do what's called pursed lip breathing. So you're just gonna breathe in through your nose, big old breath, and then breathe out like you're blowing out birthday candles. Nice and slow. Does that feel okay?
That feels pretty nice.
Good. So while you're doing these tougher activities, that's something that you can be doing, and it'll help you with that.
All right. Okay, I got my feet in. This is the hard part.
All right, you're looking dapper.
Thank you.
Okay, so on this one, I could tell that that was a little difficult for you.
I'm
So
tired.
what would you rate that one on that scale from 6 to 20?
I would give that one like a 18. That was hard.
18. That's okay. It definitely seemed like it. But if you do those compensatory strategies like the pursed lip breathing and, pulling your foot up so you don't have to bend over, that should help in the future, okay?
All right.
But yeah, good job. Okay, there is one more task I would like to see you doing, but before we do that, I would like to go ahead and redo this pulse ox real quick. That way I can just get another reading because I know that that task was like pretty hard on you,
Yeah.
and I don't want it to your levels to get to anything that could be dangerous.
All right.
So, let me see your finger. Okay, and I do see that your oxygen, it's gone down by 1 point. It's at 92 now, which, is still low, but it's not cause for concern right now. And your pulse has also changed a little bit. It's gone up to about 82. So again, it's normal to have that change when you've done some rigorous activity. So we can continue with therapy and we'll just keep monitoring this as the day goes on, okay?
All right.
The last activity I would like to see you do is try and make your bed, because I know that's very important to you, so that you can do that for your wife. We're just going to pretend that this is your bed at home, and I'm gonna have you just attempt to make your bed, and then we'll do that last rating, okay?
All right.
You doing okay?
I'm doing all right. I'm pretty tired.
If it's too much, you can take a break, sit down if you like.
That's what I'm almost done.
Okay. All right, so let's move those clothes out and have a seat there. All right, that one also seemed to be pretty tough on you.
I'm real tired.
Yeah. All right, looking at this rating scale, how would you put that one?
Oh, that one's gotta be like 19.
19?
That was very, very hard.
Okay.
I'm pretty tired. The bending over doesn't help either.
I understand that. So actually, something that you could do when you're at home and in your bed, a way to conserve energy with making the bed is before you even get out, when you wake up, you can just lay there or sit up and just try and make the other side first, like where your wife would have been. So just reach down and kind of pull those covers up that side the best that you can and almost make that side of the bed. And then you can get up and you can finish making your side of the bed, and you're almost done from that point. You haven't even gotten up yet. So you've saved a lot of energy by doing that. So that's just an idea of something that could be done.
Wow, that's pretty smart.
Yeah. All right, so I was gonna have you do some light grooming, like brushing your teeth and combing your hair, but you do seem pretty exhausted, and I understand that.
Maybe later.
I get that. So I'm gonna go ahead and grab some handouts for you, and we're just gonna go over a couple of things that we did today and a little bit of your home exercise program, okay?
All right, that sounds good.
Perfect. Okay, Charles, so we're gonna go over the results of the Borg, which was the assessment that we just completed. Basically, your scores are pretty high, which indicates that you're putting forth a lot of effort and a lot of exertion doing these activities, but that's pretty consistent with the symptoms that you are experiencing, so it's kind of what I expected. But we can work on these, and we can take these scores of the tasks that we just did, which are the tasks that you've said are important to you, and we can use these scores to kind of set goals and intertwine them with our interventions to help work on that aerobic capacity for the future, okay?
Okay.
So I'm gonna save these scores, and I have a little bit of homework for you. It's nothing crazy, there's no algebra involved or anything like that.
Good, because I'm no good at math.
Me either. So the first thing I have for you is a handout, and it's just going over that pursed lip breathing, which I kind of taught you earlier. So again, you just kind of, you've got to relax your neck, you've got to relax those shoulders, and you're gonna breathe in like you're smelling the flower, and then you're gonna breathe out through your lips like you're gonna blow out that birthday candle. And you don't want to force it out. You want it to be nice and easy, and that should help you with that shortness of breath, okay? But you can refer back to that handout if you forget anything.
All right.
So another thing I have for you is a handout over edema, which is that swelling that you have in your legs. So some of the things, I won't go over everything with you because you can read it, but some of the most important things I think are having your legs elevated as much as possible. So I know that you've mentioned that you in the evenings will like watch television, you and your wife watch the game shows. So while you're sitting there, make sure you have your legs elevated up on some pillows because that will help. And then also you can, something that's really important, especially if you're sitting there watching TV yet again, is do some ankle pumps. So you're just gonna take your ankles and you're just gonna alternate pumping them back and forth like that.
Okay.
And that will help. And you can do that while they're down or while they're elevated as well. And we can do compression stockings. I don't know if you'd be interested in trying those or not. They can be kind of difficult to put on, but it's always an option if we can't get that edema under control. And then you can always, you know, apply a cold pack down there to help reduce that swelling as well. But these are just some options that you have of things that you can do at home to help with that edema, okay?
All right.
Do you have any questions about that? No? Okay. And you can keep that. So the last thing I have for you here are just some tips to conserve energy. And as you can see here, I did highlight the parts that were most important to you. So some things that you want to consider are, one, pacing yourself. So you're retired, you're not in any hurry these days. So make sure you give yourself plenty of time to do your tasks and activities. And it's okay if some of them go slower, that's perfectly fine. You want to make sure you plan ahead, like we talked about with your dressing. So if you're gathering all of your stuff before you start the activity, then that will help conserve energy as well. And then, you know, you just want to have some good posture, make sure you're sitting upright, make sure you're staying active and moving around, make sure you're simplifying those tasks. You don't want to make things harder on yourself because that will use up a lot of energy as well. Something that I highlighted right here that you said you were interested in was like house cleaning and making the bed. So that's where I kind of explained to you how you can make part of your bed while you're still in the bed and you haven't gone up yet. And that's just explaining in more detail. But there's also other ideas right here that you can use to conserve that energy. So, you know, if you want to start helping your wife cook a little bit, here's ways that you can conserve energy doing those different kinds of tasks. Just make sure that you look at that MET chart that you said you're already familiar with and you stay within that level. You want to stay at 3 or below, okay?
Okay.
And then we have some more ideas right here, just, you know, considering like you're showering and bathing. I want you to start using that chair if you're willing, okay?
I can use it.
Okay, it will definitely help you conserve that energy so you can do the rest of the most important things, all right?
All right.
And then the very last thing I have to show you, and this is probably the most important, okay? It is called the Heart Failure Action Plan. And basically there are different zones. So you're gonna kind of assess yourself, and whenever you're feeling some of these here at the top, you know, you're okay, you're good to go, you can keep doing your everyday functioning. If you start experiencing some of these down here that are in the yellow, you need to start being concerned, maybe call your doctor, you could call the nurse, call your home health aide, make sure you tell your wife, things like that, because that means that, you know, maybe your medication's not working or we've got to change up part of your plan of care. Now, the most important one is down here in the red. If you're starting to feel some of these symptoms, like you can't breathe hardly at all, you're feeling lightheaded, dizzy, confused, you've got chest pain, those are urgent. So if you experience those, you need to call your doctor immediately, possibly call 911 as well. You need to get to a doctor, okay?
All right.
So those are things, just make sure every day you're kind of assessing how you're feeling physically and mentally, all right?
I take this home?
Yep, you can take all of this home. That's all for you. I would just read over it. You may even give it to your wife and let her read over it too.
Oh yeah, I'm gonna give it to my wife.
Good deal. Do you have any questions for me?
I don't think so. So
Okay, well, it was nice to work with you, Charles, and hopefully I'll see you again soon.